tonsil, this is the medial surface of tonsil, and there is bulging of tonsillar fossa and soft pellets are congested. The treatment of choice is the incision and drainage and IV antibiotics. This diagram showing the retropharyngeal abscess. Can you appreciate the bulge in the oropharynx? There is abscess formation, start abscess formation in the oropharynx. It is known as retropharyngeal abscess. The treatment of choice is INT, incision and drainage and IV antibiotics. Sometimes in case of acute tonsillitis, there is lymph node present in retropharyngeal area. It gets infected and it is known as retropharyngeal lymphitis or suppurative retropharyngeal lymphitis, which can rupture and form abscess in retropharynx. This picture is can be seen as a picture of parapharyngeal abscess. This also there is bulging of this tonsillar fossa, and there is some swelling also in external area also of parapharyngeal space. The treatment of choice is INT, incision and drainage, and IV antibiotics. So, what is chronic tonsillitis? It may be complication of acute tonsillitis. Pathologically, microabscess bored off by fibrous tissue have been seen in lymphoid follicles of tonsils. Mostly affect children and young adults. Rarely occur after 50 years. Chronic infection in sinuses or teeth may be a predisposing factor. Types of chronic tonsillitis. Chronic follicular tonsillitis. Tonsillar crypts are full of infected cheesy material which shows on the surface as yellowish spots. Chronic parenchymatous tonsillitis, there is hyperplasia of lymphoid tissue. Tonsils are very much enlarged, may interfere with speech, deglutition, and respiration. Then chronic fibroid tonsillitis, tonsils are small but infected with history of repeated sore throats. So chronic tonsillitis is nothing, just it is a complication of acute tonsillitis, or there is repeated episodes of acute tonsillitis which not get a proper medication and all. This leads to chronic tonsillitis. Then what is the clinical feature of chronic tonsillitis? Same as acute tonsillitis, there is recurrent attack of sore throat or acute tonsillitis, chronic irritation in throat with cough, bad taste in mouth and foul breathing due to pus and crypts, thick speech, difficulty in swallowing and choking stress at night, when tonsils are large and obstructive. There is one other thing also, there is OSL usually complains in adult patient of chronic tonsillitis, obstructive sleep apnea. So there is the choking stress at night. Then examination, tonsils may show varying degree of enlargement. Sometimes they meet in the midline chronic parenchymatous. Case of chronic parenchymatous tonsillitis, there may be yellowish beads of pus on the medial surface of tonsils in case of chronic follicular type. And tonsils are small, but pressure on the anterior pillar express frank pus or cheesy material is known as agglutination. So if the follicular tonsillitis, if you press the medial surface of tonsil, there is excretion of pus or yellowish spots. It is known as agglutination. Then the flushing of anterior pillars compared with the rest of pharyngeal mucosa is an important sign of chronic tonsillar infection. Enlargement of jugular-digestive lymph node is a reliable sign of chronic tonsillitis. During acute attacks, the nodes enlarge further and become tender, which is known as good sign. So good sign is present in the acute tonsillitis, not in chronic tonsillitis. So the treatment part of chronic tonsillitis, the conservative treatment consists of attention to general health, diet, treatment of coexistent infection of teeth, nose, and paranasal sinuses. Then tonsillectomy is indicated when tonsils interfere with speech, deglutition, and respiration, a cause of recurrent attacks of tonsillitis or sore throat. So, what are the indications of tonsillectomy? There is one criteria, it is known as the Paradise criteria for tonsillectomy. The criteria has the minimum frequency of sore throat episode. So, 7 or more episodes in the preceding year, or 5 or more episodes in each of preceding 2 years, or 3 or more episodes in each of preceding 3 years. Then the clinical feature are temperature more than 38.3 degrees Celsius or more than 101 degree Fahrenheit. Then cervical and frontotemporal tender lymph node or more than 2 cm, tonsillar exudate present or positive culture for benign hemorrhagic streptococcus. Then treatment is antibiotic had been administered in conventional doses for proved or suspected streptococcal episodes. So you generally know the meaning of the criteria for non-selective patient is the paradise criteria for indication of dose. Anyone know the position of non-selective dose position? So in this nose position, the head is supported by the head wing and the shoulder is supported by the shoulder. This is shoulder posture. So the neck is extended. Then this is the patient preparation before starting the tonsillectomy procedure. So this is dryness bifurc. This is pouch shape is mouth gap, and this dryness bifurc is supported by the complex plate. This is head of patient, and the surgeon seated behind the head of patient. The techniques of tonsillectomy, there is cold and hot methods. The cold methods are dissection and smear method, which is most commonly done. Then there is the guillotine method, which is expounded now. It is generally used previously before the dissection and smear method. Then there is the harmonic scalpel ultrasound method, plasma mediated ablation technique, and cryosurgical techniques. The hot methods are electrocautery technique, laser tonsillectomy by CO2 or ATP lasers, and combination tonsillectomy. This is two methods. The first picture is showing the dissection and smear method, which is cold method. In this there is tonsillar holding forceps by which tonsils pull medially and smear are engaged by the tonsillar holding forceps. And tonsils pulled medially and smear engaged to the pole of tonsil by the lower and cut and press the tonsil from the lower pole of tonsils. Then second method is the coblation method. In this, the tonsil pulled medially and this instrument is known as coblator. It is used to dissect the tonsil from the tonsil. So one is this is cold method and this is hot. Then what is the complication of tonsillectomy? This is important question for all of you. The complication of tonsillectomy is divided into three parts. Three parts actually. There is immediate and delayed complication. So immediate complication of clots, application of pressure on Grisel syndrome is due to subluxation of atlantoaxial joint due to positioning of tonsillectomy. अगर अपन hyperextension कर देंगे neck का तो there is subluxation of atlantoaxial joint. Now dilute adrenaline or hydrogen peroxide with pressure usually sufficient to control the bleed. For profuse bleeding, general anesthesia is given and bleeding vessel is electrocoagulated due to fiber tissues. Then some kind of infections of tonsillar fossa may lead to paralysis or bacteria. These are all delayed complications. Then lungs complication is acute respiration of blood, mucus or tissue fragments may cause atelectasis or lung sepsis, scarring in soft palate and pillars. Then tonsillar remnants, tonsil tags or tissue left due to inadequate surgery may get repeatedly infected. And hypertrophy of lingual tonsils. This is a late complication and it is compensatory to loss of palatine tonsils. The important part of surgical intervention is post-operative care. There is immediate general care. Keep the patient in coma position until fully recovery from anesthesia. Keep a watch on bleeding from nose and mouth. Keep check on vital signs like pulse, respiration, and blood pressure. Diet. When patient is fully recovered, he is permitted to take liquids like cold milk or Sucking of ice cubes give daily from pain. Usually avoid hot foods or like it is usually given the cold beverages like cold milk, ice cream, and sucking of ice cubes give relief from pain. There is plenty of food should be encouraged. Oral hygiene should be maintained. Patient is given quantities or stored salt water always 3 to 4 times a day. A mouthwash with plain water after every meal helps to